Westmoreland Community Connections is a presentation of the Westmoreland Drug and Alcohol Commission.
Welcome to Westmoreland Community Connections, a look at issues and happenings on Classic Hits 107.1 WHJB. Here now is your host, Chad Amond, President and CEO of the Westmoreland County Chamber of Commerce.
Hello and welcome to Westmoreland Community Connections. I'm your host, President of the Westmoreland County Chamber of Commerce, Chad Amond. I am delighted to have with me today on the show Janet Watkiss. Janet is an occupational therapist with TEIS. TEIS is Early Intervention Provider. Janet, thank you very much for being on the show.
I'm so glad to be here.
So tell me a little bit about your background and how you got to TEIS.
Well, I've been an occupational therapist, primarily just working with children my entire career for about 17 years. I had worked at the Children's Institute for about 5.
Oh, right.
I met my employers, Tara and Julie, who are physical therapists and owners of TEIS. At that time, we were all working together. They broke away and began an early intervention provider agency and contacted me, and I've been working with them for about 14 years doing specifically early intervention.
Okay. Well, tell the listeners, what is early intervention? I think that maybe they understand, maybe they don't. So give us a little bit of background of what is TEIS and what is early intervention?
Okay, so early intervention is a service that is designed to work with babies and toddlers, specifically in their home or daycare setting, anywhere where they spend the majority of their day. And we work very closely with parents because it's about educating, training parents in ways that they can help their children develop to their maximum potential, reach all their developmental milestones, and just all those key points that we want to see occur. And sometimes we know we're working with children who are delayed in their walking, delayed in talking. We have a lot of children that we see that have feeding disorders. So they struggle even from birth maybe to accept a bottle or to breastfeed. So we have occupational therapists that will come in and help families through that. Or a lot of children really struggle when they transition from a bottle into feeding pureed foods or baby foods.
Right.
And then it's even more difficult transitioning to whole table foods. And then we have speech therapists that, specifically help children with early language. I mean, there's so much early language that goes on from the babbling and their first words of mama and dada and so forth to actually learning to talk and communicate what they want, what they need, and express themselves. We have dietitian services. So children that have a diagnosis of failure to thrive can have a dietitian come in and help really closely look at their calories and volume. And so we have a number of services that we provide to families in home. If their children have any mild to severe developmental delays, so it's across a whole gamut of like who may need services.
Okay, so when we talk about the developmental delays, are we talking kids that may be born with that issue, or is it a something that they develop as they grow? I mean, I'm trying to understand it myself. So is this something that maybe the child is born with because the parents are addicted to opioids, or is it something that maybe it's just that the child is born, it's a DNA thing? Is it come from all different spectrums?
It does come from all different spectrums. So sometimes, I mean, of course, obviously, when you have a child that's born with a either known diagnosis that something's happening even in utero, if there was some testing done ahead of time, or if we know that the mom had some exposure to drugs or alcohol, that baby, of course, would be at risk, but not always.
Okay.
And babies that are born premature, almost every time anyone is coming out of a NICU, the services at any of the NICUs at the hospitals are suggesting that families contact early intervention services.
To just walk them through that process, because probably there's a small percentage of the population that has to deal with this. Maybe they're not educated as well, right?
Exactly, yeah. So, and then often there can be children born full term. Everything looks great. Delivery, pregnancy and delivery was textbook perfect.
Right.
And then as children begin to mature and develop, sometimes, as they reach certain ages and stages, all those milestones that we really like to watch for as therapists, pediatricians, early educators, if they're not hitting those milestones, then, it could be suggested to the family to contact early intervention services and have a screen. They can have a free screen. We come right to your home or a daycare setting, do the screen and let you know where your child is currently, developmentally, based on their age.
You're listening to Westmoreland Community Connections on Classic Hits 107.1 WHJB. We're talking with Janet Watkiss. Janet is an occupational therapist with TEIS, early intervention provider. Janet, what is the difference between early intervention and outpatient therapy? Is there a difference between the two cycles?
Absolutely, a big difference. Having worked in both settings, pediatric clinical setting and now early intervention that takes place typically within the home, right there is a big obvious difference. Whereas I think, with early intervention, we follow something called a coaching model, which is really partnering with a parent or parents, grandparents often. I mean, so many grandparents are helping to raise their grandchildren as well, partnering with them and teaching them ways that they can set up their daily routines so that the child is like reaching these developmental milestones and learning and growing and thriving. And so we're sort of there to sort of coach them along, whisper, give them strategies, demonstrate, and teach them how to do these things on their own throughout the week.
So for the listeners, one of the things that you've said a couple of times is developmental milestones. Mm-hmm. Give an example of some of the developmental milestones that a child, we're talking from birth to 3 years old, correct?
Correct.
So what are some of those developmental milestones?
So when you're looking at gross motor milestones, which is crawling and sitting and walking, typically we see most children walk by their first birthday. Okay. But it can be still considered typical all the way up to about 16 months. And then after 16 months, if the child is not walking independently, that's considered a developmental delay.
Okay.
Could be mild, could just need a little extra support in order to get things moving along.
Right.
Feeding, I mentioned that earlier. A lot of children, we hope to see them really be transitioned from a liquid diet of their formula, breast milk, a liquid diet to eating foods, that their family eat every day in their home. So, by the time they hit their first birthday, again, we want to see them eating a lot of whole foods and table foods that, the family, soft, of course,
yeah, sure.
mashed or, fork mashed for their kiddos. But, and then also like with speech and language development, we want to see those early first sounds that I had mentioned earlier. And if they, we have sort of all these lovely developmental charts that's steeped in research about when these things typically happen. And when they don't, that's when, we want to say to families, you really need to talk to your pediatrician about this. Or your pediatrician may say, I really want to see you, have a developmental assessment completed. And then they can specify which area that they feel is the most concerning for their child.
So when the pediatrician says you need to contact TEIS because the developmental delay is something that is a concern, how do they pay? I mean, do you accept insurance? Is it out of pocket? How does it work?
Well, one of the beautiful things about early intervention is this is a state-funded program. It comes through the state of Pennsylvania, the Department of Welfare, and all families, regardless of your socioeconomic background, are entitled to receiving early intervention services if their child has a known medical diagnosis.
So you don't need to be on welfare, even though it's funded through the Department of Welfare. doesn't matter what your income is, you can access your services.
Absolutely, yes. I've had the whole gamut of like different backgrounds, families that are receiving early intervention services. So that is no worry or concern for any families, because I always say it's one of the best ways our tax dollars serve families.
Yeah.
And working with children from birth to 3 years old is prime time for brain development. In fact, 0 to 5 is the most that our brains, develop across our lifespan. So working with children, especially infants and toddlers, is just prime time to make sure that, they're reaching their, again, developmental milestones. So it gets them ready for preschool and then, all the way up through the elementary school years. And research has shown, like over time, that, if children receive services before the age of 3, it often can be, a huge decrease in cost to, our education programs.
Yeah, I've seen that before with the chamber is involved in early childhood education, and a proponent for it, and we've seen the numbers that by 4th grade, if the child isn't at reading capacity, there's a huge estimate that they are going to be maybe paid for by the state at some point. Whether it's going to be welfare or prison or all of those things. So it obviously there is an impact on the impacting the early time of a human being's life. But you talked about the developmental milestones. What are some of the developmental issues that you see? We talked about some of them that we hope to get, but what are some that you see day to day?
Day to day, it can cross, a number of diagnoses. As far as medical diagnoses, often babies coming out of the NICU, from prematurity have a failure to thrive diagnosis. And that's because there was such a low birth weight. We work with children that have maybe different genetic chromosomal disorders, such as Down syndrome, a variety of syndromes. Children that are maybe ultimately or eventually diagnosed in the autism spectrum disorder. We see children with physical disabilities such as cerebral palsy, different types of muscle atrophy conditions that children are born with. So we see it all. Like we see things from physical disabilities to children that are struggling with some behavioral issues as well. So it can be a number of things. In a given day, the types of situations that I'm helping families through can just vary from house to house.
Well, the pediatricians and yourself are so skilled in this, and they know what to look for. What do the parents need to keep their eyes on? I mean, if you're a parent with a newborn, what do you need to make sure that you're looking out for?
A parent of a newborn, you do want to see, are they paying attention to their mother or father's voice? Because those should be familiar sounds. Okay. Are they turning their head and their eyes in that direction? Of course, because a newborn's vision is not developed as it should, as we are. But so you want to look for those kind of things. You want to look to see, are they eating an ample amount? Does their muscle tone feel normal? Like when you hold your child, do they feel sort of, does their muscle or just, their resting posture, like laying in your arms, does it feel like normal to you? A lot of parents say, something seemed wrong to me.
Right.
And I just couldn't tell what it is. And I do always say to parents, always go with your instinct or your gut.
Yeah.
Because most of the time, it's not usually the pediatricians that's kind of identifying that there could be a concern. It's the parent that's saying something's wrong, but I just don't know what it is. And they know. So
sometimes it's just instinct and gut. You know that there's something wrong with your child.
Yeah.
You're listening to Westmoreland Community Connections on Classic Hits 107.1 WHJB. We'll be right back after these messages.
This is Westmoreland Community Connections on Classic Hits 107.1 WHJB. If you have a suggestion for a topic, or if your nonprofit organization would like to be featured on this program, call us during regular business hours at 724-216-1200.
Westmoreland Community Connections is a presentation of the Westmoreland Drug and Alcohol Commission.
Welcome back. You're listening to Westmoreland Community Connections on Classic Hits 107.1 WHJB. I'm your host, Chad Amond, president of the Westmoreland County Chamber of Commerce. I'm delighted today to have on the show Janet Watkiss. Janet is an occupational therapist with TEIS Early Intervention Provider. They're serving Allegheny, Westmoreland, Fayette counties, and Butler counties, basically most of southwestern Pennsylvania, a lot of southwestern Pennsylvania. Janet, before we went to the break, we were talking about some of the things that the parents need to keep their eyes on. Mm-hmm. You know, the things that, you know, maybe it's a gut reaction that the child is not necessarily performing in the right way. Their eyes aren't focusing on the parent, but when a parent has this gut feeling, they probably go to their pediatrician, and does the pediatrician then need to refer that child and the family to TEIS?
They can go that route, but they absolutely do not have to. The parent can individually just contact TEIS, and we can talk them through what we could do and how, and in the ways that we could help them. They could express their concerns, and someone within our office staff could answer a lot of questions that they may be thinking about or be concerned about, and we could, suggest if an evaluation would be a great way to just kind of rule out their concerns, or if services may be needed or necessary. But we do not need the pediatrician's referral. However, with certain services, we do get a prescription for therapy.
Okay.
But we seek that out after a child qualifies to receive services.
Well, how does that whole process work? If there's a listener out there right now, and they're sitting there holding their newborn, and they just have that gut feeling, who do they contact? I mean, how do they connect with TEIS?
Well, the best way to do it is, they can certainly go to our website if they want to start there, because we have a lot of great information and a lot of developmental charts. So if you do have concerns, families can go on there and say, I'm really worried about my baby because she's not doing this. And they can look through the specific areas of development, gross motor, fine motor, feeding, language, and communication, and see if their baby is hitting those landmarks in their development. And another great way is to just call us. Just by giving us a call at the office is the best way, because the staff is very equipped to answer these types of questions and to help parents sort through their concerns.
And that number is 412-271-TEIS. That's 412-271-TEIS. Or you can visit TEIS on the web at TEISinc.com. TEISinc.com. Janet, let's talk about the part where the family is involved. How does the family get involved, or how much is the family involved in the therapy process?
Well, we want them involved 100%. Because, back in the day when early intervention services started, it was almost as though we were bringing the clinic right into the home. And the therapist was doing a lot of one-on-one, maybe doing some educating, some demonstration, where now we're following very closely, and this is a state and national mandate to follow this coaching model. So we literally are partnering with parents or grandparents together, and we want to meet you through the most challenging routines or activities of your day, so that we can see what it's like for them, how we can adapt, maybe how it's set up for the child, how it's set up for the parent, to help the child go through these activities with, and it could be something as simple as, there's a lot of kids, that struggle with movement experiences. I mean, almost like, people that can't stand riding in the back seat of a car.
Oh, right.
So, getting up into a car seat, children have these types of sensations and, not so positive feelings too at times. So we may meet them like every morning. I have to get my older children to school, and we may say, you know what, I'm going to meet you at 8:00 when you're loading all the kids so I can see how this goes. And I'm going to, be with you, walk you through it, even demonstrate if I have to. So we teach and coach and educate in a variety of ways. It can be just sitting with the parent talking through a lot of their concerns, and then looking at ways that we can adapt everything, or we're just going to jump right into the activity or routine together and try some new ways of approaching.
Well, you touched on it, but what do those therapy sessions look like? I mean, I that was a great example with the, getting the child into the car seat.
Yeah.
But what do the other sessions look like? What is a typical session, or maybe give a couple of examples of what therapy sessions look like?
Absolutely. So I'm going to touch on PT for a second, physical therapy for a second. A lot of times we want to see children. Crawling is a very, very important developmental milestone. I mean, so much happens, not just, the gross motor strengthening and learning how to move your body, but vision gets strengthened. Fine motor gets sort of strengthened because of all the, you're putting all your weight through your arms and your hands. Right. So it's kind of all these pre-motor skills that are starting to lay the foundation. So they may meet with families where they're just working on crawling between rooms or crawling upstairs to go to bed at night, so that the parent isn't carrying the child, because especially when they get to a certain age and a certain size, you want to see your child be able to, navigate the stairs.
Yeah, right.
So it could be something in that scenario or that situation, or we could be meeting them. Sometimes we can meet families right out in the community. So the grocery store is a great way to work on language development. Just identifying and labeling foods and colors, and and I think it's a really nice partnership with families when you meet them out in the community like that.
Yeah.
Occupational therapists, we work so much on working with families who have children with feeding problems. We meet at Chick-fil-A or any of the other fast food restaurants, just because it's a great place. There's a great play space. We can sit together and have a meal together.
So you're working on real life
things.
Yeah, right.
Yeah.
Right,
So
right.
it's really wonderful, and I have to say it's such an opportunity for therapists. Most of us that do this type of work, this is the piece that was missing for us in a hospital or a clinical setting.
Right.
Because we know, it looks really great when you have, in the perfect environment of a clinical setting, because the therapist sets it up. But moving and shifting into the house, or going out into church, or, a restaurant or a store,
right,
where families do their everyday activities. And these are where they have great challenges, with their children for a number of reasons, whether it's behavioral problems or movement conditions or disorders. And we just meet them where they are.
Right, right. Well, so what are some of the expectations that a family has or would hope to achieve? I mean, I'm expecting that if you have the developmental disability of maybe not being able to crawl or walk, you maybe have to set your expectation to a different level as a parent. What are those expectations? What are some of the things that you hope to achieve as you interact with these families?
Well, as therapists, working in early intervention, we always, we want to see children reach their maximum potential. So we're always striving for, what the parent wants. First of all, I want my child to walk, so we help to provide the information and education and training on the how-tos. I mean, it's step by step. How are we going to get there? And let us show you the ways that we may be able to help your child achieve and learn to walk. So, it's step by step, and we hope for the best. And with the example of walking, if children aren't walking independently, There's all kinds of training walkers. Not the type of toys that you buy in the walkers that, people used to back in the day put their children in. And we hope they're not doing that anymore.
Oh, really? Okay.
Yeah. But there's training walkers that help children be able to stand with a little extra support.
Yeah.
That we hope the children get there. And if not, then we help them find the ways and means. And sometimes it might mean equipment. Sometimes it might mean some orthotics for inserts inside their shoes to have a little more, joint stability around their ankles. So that's just one end of it, that we hope to see. With kids with feeding problems, we hope to see them be able to eat everything that their parents and family eat, all throughout the week. When 2-year-old age hits, their taste buds and their taste sensation becomes very fully mature. And that's why you see picky eaters. And parents said, oh, well, when they were a baby, they ate peas and they ate green beans and now they hate that. Well, that's because their taste sensation has matured and now they have preferences. And autonomy and independence is kicking in. And I'm 2, and I can say, I don't want that.
Yeah, we all have.
Exactly.
My mother still wants me to eat Brussels sprouts, and I just...
But whatever is important to the family, that's what we want to address. What is important to you? We have all our great developmental charts. We know as therapists, what we hope to see the children be able to do.
Yeah.
But as a parent, tell us what you want to see your child do.
So, Janet, what is TEIS most proud of?
Well, TEIS, I think, is most proud of, they do an incredible job of always fostering our education. So most of us, we're coming from, strong education backgrounds, with our degrees and so forth and our backgrounds. But continuing education is very important at TEIS, whether it's in-house training or going out and, conferencing and so forth. So we're always bringing in a lot of guests in the area. It could be people working, with behavioral health. It could be pediatricians. Could be a number of physicians have come in from Children's Hospital to speak to us. Family resource centers. So I think for my employers and the team at TEIS, we really pride ourselves on the fact that we stay on top of current trends in early intervention, what's happening nationally. And if it's happening, outside of the state of Pennsylvania, my employers, Tara Derringer and Julie Hudak, are always bringing, speakers in and training in for us to stay almost a little ahead of the curve.
Make sure you're on the cutting edge.
On the cutting edge.
Good.
That's exactly
Good.
right.
Well, we're getting close to the end of the show, so give us some closing advice that you have for new parents.
Please don't hesitate. If in your heart of hearts you think something is not happening when it's supposed to, or you think your child is just not reaching their full potential at 6 months, at 8 months, at 2 years old, don't even hesitate to call. Our staff is, there willing and waiting to answer phone calls, questions and concerns. And maybe it's just a phone call. Maybe you need someone to assure you that your child sounds like they're on track.
Right.
But if you do have, overriding concerns, then we can come in, meet you right in your home, and do a free assessment for you and find out, where your child is so that we can address the concerns and address the parents' concerns most of all.
Janet Watkiss, Occupational Therapist with TEIS, Early Intervention Provider. Thanks very much for being on the show. If you want to reach TEIS, you can jump online at TEIS Inc. That's TEISinc.com. Or you can give them a call, 412-271-TEIS, 412-271-TEIS. Janet, thanks very much for being on the show. We appreciate the good work that you're doing to serve our community. And you've been listening to Westmoreland Community Connections on Classic Hits 107.1 WHJB. Join us next week, same time, same place, for another edition of the Westmoreland Community Connections. Thanks for listening, everyone.
This has been Westmoreland Community Connections, a look at issues and happenings in and around Westmoreland County. Join us again next week on Classic Hits 107.1 WHJB.
Westmoreland Community Connections is a presentation of the Westmoreland Drug and Alcohol Commission.